Hello and welcome to Emergency Medical Responder, Chapter 12, Behavioral Emergencies. Like every class, I'm going to review the competencies that will be expected of you, and in this chapter, of course, we're going to concentrate on the competencies related to behavioral medicine, and in every chapter, we're going to remind you of the definition of medicine as it relates to you as an EMR. And medicine as it relates to EMR recognizes and manages life threats based on assessment findings of a patient with a medical emergency while awaiting additional emergency response. And we're going to move on to the other competencies you will be expected to know in relation to what we're going to learn here in Chapter 12. Behavioral medicine as it relates to the EMR specifically refers to unusual behaviors, some of which are psychiatric in nature. And in terms of what you need to know about psychiatric emergencies, is the following. You need to be able to recognize behaviors that pose a risk to EMRs, the patient, or others. We will be talking about special patient populations where you will learn how to recognize and manage life threats based on simple assessment findings for a patient with special needs while awaiting for additional emergency response. And in terms of your text, you need to read pages 244 and pages 248 through 249, which deal with recognizing and reporting abuse and neglect. Emergency situations have emotional and psychological effects on rescuers, patients, family members, friends, and even bystanders. EMRs need to give psychological support as well as necessary emergency care. There are 5 factors contributing to behavioral changes: medical conditions, physical trauma, psychiatric illness, mind-altering substances, and situational stresses. To remind you of the patient assessment steps and order, you have first the scene size up, then the primary assessment, followed by history taking, the secondary assessment, and ongoing reassessment. When you are assessing a patient who appears to be experiencing a behavioral emergency, follow the steps of the patient assessment sequence that we just went over. Complete a scene size up, being especially careful to ensure that a scene is safe for you and your crew or teammate first, and for the patient. If a patient is oriented and responsive, complete the primary assessment by observing the patient's responsiveness, airway, breathing, and measuring their pulse. The history should follow the sample format, which we've reviewed in earlier chapters. Do not neglect to ask about medical problems. It is very important not to overlook this part of the examination. The secondary assessment should rule out any obvious injuries and focus on signs of medical illness. Take a set of vital signs. Tell the patient what you're doing each step of the way. Reassess the patient every 15 minutes for a stable patient and every 5 minutes for an unstable patient. In cases where you cannot complete the assessment, document the assessment findings and the reason for not being able to complete all the steps. We're going to talk about behavioral crises now. Behavioral emergencies are situations in which persons exhibit abnormal, unacceptable behavior that cannot be tolerated by the patients themselves or by family, friends, or the community. 5 main factors contribute to behavioral changes. When it comes to medical conditions, You can have behavioral changes that result from uncontrolled diabetes that causes low blood glucose, respiratory conditions that prevent the patient's brain from receiving enough oxygen, and strokes. Other medical conditions that can contribute to behavioral issues are head injuries, high fevers, infections, and excessively low body temperature. When it comes to physical trauma conditions, these can contribute to behavioral issues as well. Again, head injuries and injuries that result in shock and inadequate blood supply to the brain. Psychiatric illness can contribute to behavioral crises, and they can include depression, panic, or psychotic behavior. Mind-altering substances can be a factor in behavioral crises as well, and they can include alcohol or a wide variety of chemical substances. There are situational stresses that can contribute to a behavioral crisis, and they can arise from a variety of emotional traumas, including, but not limited to, death of a loved one or a serious injury to a loved one. So what is a situational crisis? A situational crisis is a state of emotional upset or turmoil. The crisis is caused by a sudden and disruptive event such as a physical illness, a traumatic injury, or death of a loved one. You will often encounter this type of crisis as an EMR. Most situational crises are sudden and unexpected, such as a motor vehicle crash, for example. They cannot be handled by a person's usual coping mechanisms. They tend to last only a short time, but they can cause socially unacceptable, self-destructive, or dangerous behavior. There are 4 emotional phases to each situational crisis. People may not experience every phase during a crisis, but they will certainly experience one or more. Understanding what these phases are and why they occur will help you better treat people who are experiencing an emotional crisis. The emotional phases are high anxiety or emotional shock, denial, anger, and remorse and grief. High anxiety is characterized by obvious signs and symptoms. People have a very flushed or reddish face, rapid breathing, rapid speech, increased activity or hyperactivity, loud or screaming voice, and general agitation. Emotional shock is often the result of a sudden illness, accident, or sudden death of a loved one, and is characterized by cool, clammy skin, a rapid, weak pulse, vomiting and nausea, and general inactivity and weakness. Denial is refusal to accept the fact that an event has occurred. Your response should be as follows. Allow the patient to express denial. Do not argue with the patient. Try to understand the emotional and psychological trauma that the patient is experiencing. In regard to anger, anger is a normal human response to emotional overload or frustration. Anger may follow denial or may occur instead of denial. In a crisis, people may vent angry feelings at you or an authority figure. Do not take that person's anger personally, but acknowledge that it is a reaction to stress. Frustration and a sense of helplessness can often build to anger. Always be professional and do not react to anger by becoming angry yourself. Remain calm and deliberate in your actions and professional, and this helps to prevent the escalation of violence. An acceptance of a situation may lead to remorse or grief. People may feel guilty or apologetic about their behavior or actions during an incident or about an incident itself. With crisis management, the role of an EMR are to follow the steps of a patient assessment sequence, and we'll review them once again, not just for the sake of redundancy, but also to help you cement it into your mind. First, perform a scene size up. B, perform a primary assessment. C, obtain the patient's medical history. Next, perform a secondary assessment. And finally, provide reassessment. The most important aspect of assessment skills may be your ability to communicate well with your patient. In the next few slides, we're going to talk about communicating with the patient. First and foremost, the most important step you can take in crisis management is to talk with the person. Introduce yourself. Ask the patient his or her name and ask what you can do to help. Be honest, warm, caring, and empathetic. Position yourself at the patient's eye level. In other words, if they're sitting down, then come down to their eye level so you're not towering over them. Establish eye contact with the patient, as I mentioned. Use a calm, steady voice and provide honest reassurance. Try not to let negative personal feelings about the person or the person's behavior interfere with your attempt to provide assistance. Simple acts of kindness can comfort and reassure a patient in a situational crisis. Let's talk about restatement. This is when you rephrase a person's own words and thoughts and repeat them back to the person. It is not usually helpful to say, "I know what you mean," or "I know how you feel." Be honest and give the patient hope, but do not give false hope. In terms of redirection, sometimes a patient may be embarrassed about being the center of attention or may be concerned about others who are involved in the situation. Redirection helps focus a patient's attention on the immediate situation or crisis. Use redirection in an attempt to alleviate a patient's expressed concerns and draw his or her attention back to the immediate situation. If a patient is in a public place, move him or her to a more quiet and more private location. In regards to empathy, the ability to empathize involves imagining yourself in another person's situation and sharing that individual's feelings or ideas. Empathy is one of the most helpful concepts you can use when caring for patients in a crisis situation. Use a calm and caring approach. The principles for assessing patients with behavioral problems involves communication skills. Identify yourself and let the patient know you're there to help them. Inform the patient of what you're doing. Ask questions in a calm, reassuring voice. Allow the patient to tell you what happened. Do not be judgmental. Show you are listening by using restatement and redirection that we just talked about. Acknowledge the patient's feelings. Assess the patient's mental status, including appearance, activity, speech, orientation to person, place, and time, mood, thought process, and memory. Let's talk about communication with patients with developmental disabilities. CDC data indicate 1 in 6 children has a developmental disability. Developmental disabilities range from learning disabilities and developmental delays to autism spectrum disorders. For example, patients with autism might avoid eye contact and want to be alone, not look at objects with another person when another person points to that. They have trouble expressing their needs using typical words or motions. They appear to be unaware when people talk to them, but they do respond to other sounds. They have trouble adapting when their routine changes and prefer not to be held or touched. Let's talk about crowd control now. Performing simple crowd control may help reduce a patient's anxiety when there are too many people around. Any emergency personnel who are not needed right away should leave the room or the immediate area until the patient is calm. During your initial size-up of the scene, determine whether there is a crowd that might become hostile. It is better to ask for help with an unruly crowd early than wait until the situation is truly unsafe for you and the patient. We're going to move on now to domestic violence. Domestic violence is a common occurrence in today's society. It's actually always been an occurrence in society, but it's much more widely known about, discussed, and reported on than it was in times past. Its different forms in terms of domestic violence include elder abuse, child abuse, and spouse and domestic partner abuse. EMRs need to be able to recognize signs and symptoms of abuse and to understand the 3 phases in a cycle of abuse. When responding to a domestic violence call, you need to maintain safety for all rescuers as well as that for the patient. Next, you need to conduct an effective assessment and provide treatment, and then understand the requirements for reporting abuse in your state. The signs and symptoms include physical injuries, the emotional state of the victim, and personality indicators of an abuser. The physical injuries that you might see include broken bones and cuts. You might also see head injuries, bruises, and sometimes bruises in different stages of healing, burns, scars from old injuries, injuries in various stages of healing, so not just bruises, but other injuries, and internal injuries might be encountered as well. You will probably also encounter emotional symptoms in terms of domestic violence, and they can be depression, former suicide attempts, abuse of alcohol or drugs, and feelings of anxiety, distress, and helplessness. Abusers may be paranoid, overly sensitive, obsessive, or threatening. They often abuse alcohol or drugs, and remember this, most importantly, they often have access to weapons. If you suspect abuse, your responsibility is to maintain safety for yourself and for the patient. To diffuse a tense situation, try to separate the patient from the abuser. As you question a patient, express your concern. Try to keep from judging the patient. If the patient refuses transport, some agencies provide information about domestic abuse shelters. In some cases, the presence of law enforcement personnel will be helpful. Learn the requirements for reporting cases of suspected abuse in your state. I mentioned previously the cycles of abuse. One cycle is the tension phase. The abuser becomes angry and often blames a victim. The victim may try to placate the abuser or minimize or deny abuse, and the tension phase is usually the longest part of the abuse cycle. Second is the explosive phase, where the abuser becomes enraged and loses control as well as the ability to think clearly. Most injuries to a victim occur during this stage. Then there is the makeup phase, where the abuser makes promises which are seldom kept, and this phase helps keep the abused person in the relationship with the abuser. EMRs may enter a domestic scene anywhere in this cycle, so understanding this cycle will help you anticipate the actions of both the abuser and the victim. We're going to move on now to violent patients. If you have a violent patient, immediately attempt to establish verbal and eye contact with that patient. This begins the process of establishing rapport. Check with family members and friends about the patient's past history of violence. And check for signs of potential violence, a history of violence, or yelling and verbal threatening. There can also be loud, obscene, or bizarre speech, pacing, the inability to sit still, or protection of personal space, and abuse of drugs or alcohol. Never force a potentially violent patient into a corner, and do not allow yourself to be cut off from a route of retreat. When we talk about establishing scene safety, this is one of those things you should consider. Have only one person talk with the patient. The communicator should be a rescuer with whom the patient seems to have the best initial rapport. Anticipate the need to summon law enforcement personnel if all other means of approach and intervention fail. Violence against EMRs can occur. Several factors increase the risk of violence in the workplace, including working alone or in small numbers, working late at night or in early morning hours, working in a high crime area, and working in a community setting. Be alert when you respond to a call that has an increased chance for violence, including in the following situations: crime scenes, incidents involving gangs, large gatherings of hostile or potentially hostile people, and domestic disputes. Although EMRs are more likely to be involved in potentially violent situations than the average citizen, there are ways to minimize risk of injury. Take the steps to keep yourself and other rescuers safe at these scenes. And as I mentioned earlier, always keep an escape route open between you and the patient. When it comes to prevention, prevention is the best way to avoid violence. As you arrive at a scene, use your personal antenna, so to speak, to pick up any signs that you may be approaching a violent situation. Make sure you have an escape route in mind. Your ability to use good interpersonal communication skills will help prevent many situations from becoming violent. If you think you need backup or law enforcement personnel, request it as early as possible. You may encounter an armed patient. It is not your role to handle an armed patient unless you are a law enforcement officer. Be alert for potentially threatening situations and summon the assistance you need if you think a person is armed. Stay in your vehicle if you must wait for law enforcement. If, despite caution, you are confronted by an armed person, immediately attempt to withdraw. We're going to discuss medical and legal considerations now. You must understand the laws of your state and the community that relate to dealing with emotionally disturbed patients. If an emotionally disturbed patient agrees to be treated, few legal issues should arise. If a patient who appears to be disturbed refuses to accept treatment, it may be necessary to provide care against the patient's will. You must have a reasonable belief that the patient would harm themselves or others. As an EMR, you usually will not be responsible for transporting the patient, but you should know what laws in your state permit you to do so. If you are required to restrain a patient, consider these factors: the patient's size and apparent strength, the patient's gender, the type of abnormal behavior you're witnessing, the patient's mental state, and the method of restraint. You may use reasonable force to defend yourself against an attack by an emotionally disturbed patient. To prevent problems, if you must restrain a patient, seek assistance from law enforcement officials or from your medical director. Document conditions present in cases where you must restrain or subdue a patient. Whenever possible, a caregiver of the same sex should take primary responsibility for care of a patient. There are other types of emotional crises, and one of the ones you might deal with could be attempted suicide. And of course, in this situation, like all of the others that I've been discussing, you must have good communication skills. Each year, thousands of people, from teenagers to elderly persons, attempt suicide. Many patients who fail at their first attempt will try to commit suicide again. Most people who attempt suicide have a serious psychiatric illness such as depression or alcohol or substance abuse, or the patient may be under the influence of drugs and alcohol and attempt suicide a first time. The underlying psychiatric disease is usually treatable, and with proper treatment, the patient will no longer be suicidal. Review the risk factors that make it more likely that someone will consider or attempt suicide, and this is outlined for you in Table 12-1. Management of an attempted suicide consists of the following steps. First, protect yourself and the patient from further harm. Obtain a complete history of the incident. And third, determine whether a patient still has a weapon or drugs on him or her. Fourth, you should support the patient's ABCs if and as needed. Fifth, make sure to dress any open wounds. Sixth, treat the patient for spinal injuries if indicated. Seventh, do not judge the patient. Treat him or her for injuries or conditions that you discover. And eighth, provide emotional support for the patient and the family. Another type of mental disorder that you might encounter is post-traumatic stress disorder, or PTSD. PTSD is a mental health or behavioral condition triggered by experiencing or witnessing a terrifying event. People experiencing PTSD get worse with time, and their anxiety interferes with their normal day-to-day activities. Symptoms include intrusive memories of a traumatic event, avoidance of places, activities, or people that remind them of a traumatic event, negative feelings, and tremendous emotional reactions. When dealing with PTSD as an EMR, your job is to protect the patient from harm, speak with the patient in a positive and supportive way, and arrange for the patient to be transported to an appropriate medical facility for evaluation and treatment. Sometimes people who suffer from PTSD will tell you that they have PTSD, so that is something to bear in mind. We're going to deal now with sexual assault. Victims of sexual assault may be men or women, old or young. The psychological aspects of treatment are important. You may have to delay all but the most essential treatment until a responder of the same sex as the patient arrives. Your first priority is to provide for the medical well-being of the patient and treat any injuries the person may have. You need to bear in mind that sexual assault not only causes extreme emotional duress, but it is also a crime. So do not remove clothing except to give medical care. It's preferable for you to not remove clothing at all. Your best option is to cut clothing to get to injuries to treat. But if you do, you must carefully note where you cut their clothing, why you cut their clothing, what you used to cut it with, because those types of cuts on clothing, it needs to be reflected that you were the one that cut their clothing in a certain area and why, so that that can be maintained as separate from any other cuts or tearing that their clothing may have. Try to convince the victim not to bathe or use the toilet. Keep the scene and any evidence undisturbed and as intact as possible, and avoid aggressively questioning the patient about the incident. You need to just ask the most general questions that you can and let them volunteer what information they're able to volunteer at that moment, given their state of mind and what it might be. Be sure to treat the patient with empathy and maintain the patient's privacy by covering him or her with a sheet or blanket. And do not leave the patient alone. Moving on to death and dying. This is something that you will encounter, and it could be death and dying from a natural process. It could be accidental, and it could be intentional. So you will encounter death and dying from natural, accidental, and intentional cause. Do whatever you can to meet the patient's medical needs. Your attempts to save or give comfort to the patient help everyone to deal emotionally with the patient's death. Most people are afraid of dying, so that's one thing you need to do is work through your personal feelings about death so that you can confront it in the field. Consider the psychological needs of a patient and his or her family. Do not be afraid to touch. Make sure that you touch someone gently, like just gently placing your hand on their arm or shoulder. It's comforting, and we talked about this in an earlier chapter. Make positive statements, but do not give false hope, and provide comfort in any way that you can. We need to talk now about coping with work-related stress. And providing emergency care is stressful for EMRs. If you let stress build up without releasing it in healthy ways, it can begin to have negative effects on you and your performance. Signs and symptoms of extreme stress include depression, inability to sleep, weight changes, increased alcohol consumption or drug abuse, inability to get along with family and coworkers, and lack of interest in food or sex. To help prevent excess stress and relieve stress caused by critical incidents, psychologists have developed a critical incident stress debriefing process known as CISD. CISD brings rescuers and a trained person together to talk about the rescuer's feelings. CISD may help rescuers understand the signs and symptoms of stress and receive reassurance from the group leader. CISD allows people to obtain more help from trained professionals if needed. Peer support is a process involving a properly trained member of your department to provide confidential support to another member who is experiencing personal, emotional, or work-related problems. I can't stress enough how important critical incident stress debriefing is. There are professional rescuers who refuse to participate in that, and most of the time, by a large percentage, most of the time, failure to relieve that stress through healthy means and not participating in critical incident stress debriefing has a tremendously negative effect on the rescuer. So if your company or whoever you go to work for provides it, and all of them do for the most part, make sure you take advantage of and participate in CISD. Approach it with an open mind and appreciate the fact that the reason it exists is because it needs to exist and is tremendously helpful. So let's go through a summary of what we've covered in this chapter. Only a small percentage of patients you treat will be severely mentally disturbed, but almost every patient you care for will be experiencing some degree of mental and emotional crisis. No matter which type of incident or crisis is taking place, your response is always to be there to help the patient. Behavioral emergencies are situations in which persons exhibit abnormal, unacceptable behavior that cannot be tolerated by patients themselves or by family, friends, or the community. We talked about the fact that there are 5 major factors that cause behavioral crises: medical conditions, physical trauma conditions, psychiatric illness, mind-altering substances, and situational stresses. Remember also that we covered the fact that 4 emotional phases to crisis are high anxiety or emotional shock, denial, anger, and remorse or grief. Although a person may not experience every phase during a crisis, he or she will certainly experience one or more of these phases. We discussed how your role as an EMR consists of assessing patients and providing physical and emotional care. Your most important assessment skill may be your ability to communicate well with the patient. And we also talked about how you must understand the laws of your state and community that relate to caring for emotionally disturbed patients. Because if an emotionally disturbed patient agrees to be treated, few legal issues should arise. However, if a patient who appears to be disturbed refuses to accept treatment, it may be necessary to provide care against a patient's will. To do so, you must have a reasonable belief that that patient could harm themselves or others. If you have to provide transport and treatment without their consent, you need to make sure that you know the laws in your state pertaining to this. And I want to say one more thing, even though we didn't really talk about it specifically in the chapter. We have, in essence, talked about it, but I want you to remember to ask yourself this question in just a moment. Even when you have thoroughly mastered the processes and tools for managing behavioral crisis, it is important to remember that sometimes the best approach is to ask yourself this question: how would I like to be treated if I were in the patient's shoes? You should always approach treatment of every patient, emotionally disturbed or not, thinking about this particular question. Now let's go through some review questions. Question 1. Behavioral emergencies are situations in which a person exhibits A. Abnormal behavior that is deemed unacceptable by others. B. Mild to moderate depression over a long period of time. C. Anger that is justified by the situation. Or D. Strange behavior, but even though the patient's displaying strange behavior, they are otherwise mentally stable. And the correct answer is A. Behavioral emergencies are situations in which a person exhibits abnormal behavior that is deemed unacceptable by others. Question 2. Which of the following is not considered an emotional phase in a situational crisis? A. Anger. B. Denial. C. Grief. Or D. Violence. This one should be fairly obvious for you. Of course, it is D, violence. That's not an emotional phase. And this is review question number 3. When treating a patient with PTSD, which of the following steps is correct? A, protect the patient from harm. B, speak with the patient in an authoritative, forceful way. C, convince the patient to take care of the problem themselves. Or D, contact law enforcement immediately. This one should be pretty obvious. And of course, the correct step that you should take, the correct answer is protect the patient from harm. Class, thank you so much for your attention here in Chapter 12. I hope that you have found this to be helpful to you. I always encourage you to contact your instructor if you have any need for clarification or if you have any questions. And again, thank you for your time, and we will meet again for Chapter 13.